This next part focuses on the joints. So a joint or an articulation is the place where two bones meet. Joints are usually given 3 names. So they're classified based on the tissue that binds them, based on the degree of movement at the joint, and then based on the specific type of joint that's found there. So if we talk about the movement at the joints, we have synarthrotic, which is immovable, amphiarthrotic, which is semi-movable, and diarthrotic, which is freely movable. A synarthrotic joint would be the places where your skull bones come together. So you can't even slightly move the places where your skull bones come together. Amphiarthrotic, slightly movable. An example would be at the end where the tibia and fibula come together. So those bones in the ankle kind of slightly move past each other. Diarthrotic or freely movable, this is what we think of usually when we think of joints. So our joints in our elbow, our shoulder, our hip, our knee, all of those are diarthrotic joints. They're freely movable. And then we have the tissue. So there's fibrous tissue, cartilaginous tissue, and synovial. And we'll talk about some specific examples of each of these. So examples of fibrous joints include the syndesmosis, which is at the distal end of the tibia and fibula. So that's where those bones come together, and you can see them here in the ankle. Sutures, so the bones that connect, or the bones are connected together in the skull by suture joints. And we'll learn about some of the major sutures when we go through the bones of the skull. And then gomphosis, that's the bones of the teeth. So if I were to describe 3 terms that describe the tooth. The movement. Can you wiggle your teeth? No. So, synarthrotic. The tissue is fibrous, and the specific type is gomphosis. Cartilaginous joints. We have synchondrosis, which usually disappears as we age. So that's the cartilage here that you'd find in the epiphyseal plate. And then symphysis. So symphysis, that's right here where the 2 pubic bones come together. And that holds the bones together using cartilage. So if we were to describe 3 words for the pubic symphysis, the movement is slightly movable or amphiarthrotic. The tissue is cartilage, which we call cartilaginous, and then the specific type is symphysis. So now we go on to the synovial joints. So most joints are synovial joints. They're freely movable. They have articular cartilage, a joint capsule, and a synovial membrane, and then they're filled up with fluid on the inside. So the major parts of a synovial joint, first of all, we have the capsule. And the capsule completely encloses the joint. Then we have the tendons and ligaments that are going to connect the bones together and hold muscle to bone. Then we have articular cartilage. This specific type of cartilage is hyaline cartilage. And that's going to be a smooth surface for the bones to glide past each other on. Then we have bursa. And the bursa is a pocket that kind of serves as a cushion. So it's going to help cushion the tendons and ligaments so that when this joint bends, it's not like going to break anything. So if you think about taking a piece of string and bending it over a sharp edge, and then every time you do that over the course of many years, that string is going to become thinner and thinner and thinner because of the friction. It's going to kind of wear away at that string. Eventually that string is going to pop or snap. So if we have this bursa, and multiple would be bursae, then it acts as kind of a pillow, like you're putting a pillow underneath that string, so that every time that this joint bends, it's bending over this cushion, so it decreases the likelihood of it having issues later on in life. Just inside of the joint capsule is the synovial membrane, and the synovial membrane is going to produce synovial fluid, and that synovial fluid is going to fill up the joint, and that's going to decrease the amount of friction inside of the joint. So what are the types of synovial joints? The first one is a hinge joint. A hinge joint is going to move in one direction, like the hinge of a door. So this is a picture of a hinge joint. And an example of where you would find a hinge joint would be the elbow. So the elbow, the knee, and some of the fingers. A ball and socket. A ball and socket is where a round projection or process fits inside of a concave area. There are only two ball and socket joints in the body, in the shoulder and in the hip. We're going to learn the specific names for those cavities. So for example, the one in the shoulder, the head of the humerus sits in the glenoid fossa or glenoid cavity of the scapula. For the hip, we have the head of the femur that sits inside the acetabulum of the pelvis. In a saddle joint is when two bones kind of saddle over each other. An example of a saddle joint would be in the thumb. A gliding joint or a planar joint is where the bones are going to glide past each other. All of the vertebrae, all the bodies of the vertebrae are going to glide past each other in a gliding joint. And then a condyloid joint, also known as an ellipsoid joint, is where bones are going to fit together similar to a ball and socket, except the movement isn't around all the way in a circle, it's just in a few different directions. An example would be in the neck here, so where the base of the skull comes to the first vertebrae. So now we're going to describe some of the movements that can happen at joints. Flexion versus extension. So flexion is when you decrease the angle between two bones, while extension is when you increase the angle between two bones. Hyperextension is when you increase the angle between two bones beyond normal anatomical position. So extension would be pointing the fingers out forward, while in hyperextension would be bending the fingers all the way back. If you take your head and look up toward the sky, that's technically a hyperextension of the neck. Dorsiflexion versus plantar flexion only involve the feet. Dorsiflexion is when you flex the toes and point them up toward the shin, or up toward the back of the body. While plantar flexion is when you plant the toes into the ground, so you bend the foot downward. Adduction versus abduction. In adduction, look at add here, you're adding the body part back to the body. So it's bringing a body part back toward the midline. Abduction If you get abducted, somebody's taking you away from something. If you get abducted by aliens, you're going to be taken away from planet Earth. So abduction is talking about moving a body part away from the midline. So if you raise your arms up to its sides, you're abducting the arms. Rotation, circumduction, supination, and pronation. So a rotation happens at a pivot joint, so where bones can pivot back and forth. If you were to take the palm of your hand and turn it up and down and up and down, you are rotating the arm up and down and up and down. If you take your head and look left, right, you're rotating the head left, right. A circumduction is when you take a body part so that its end follows a circular pattern. So if you rotate your arm around in a circle, then you are circumducting the arm. You're making it follow a circular motion. Supination versus pronation refer to the hands and the placement of the palms of the hands. In supination, you're moving the palm of the hand forward. Pronation, you're moving the palm of the hand backwards. So think about holding a cup of soup. If you had a cup of soup, your palm would be facing forward. So supination, you're holding that cup of soup. Pronation, you turn the soup down, you pronounce the soup. Maybe it was disgusting soup and you wanted to drop it on the ground. So you pronate the hand, you're going to turn the hand backwards or down. Protraction and retraction. Protraction is when you move a part of the body forward, while retraction is when you move a part of the body backward. Elevation and depression. Elevation is when you raise a body part. Depression is when you lower a body part. So if you shrug your shoulders, you lift them up, that's an elevation. You just didn't do so well on the exam, you sulk your shoulders or you lower down your shoulders, that's a depression.